if you feel your sleep has been impacted by social isolation, it is first important to ask yourself why this is happening or why this might be happening. Am I reading too much about coronavirus and this is causing me to feel extra anxious? Am I eating my meals regularly and keeping my daily schedule? Am I too much stressed out with the pandemic or with the financial burden of the pandemic, or worried too much about my health or my family or my friends' health? Of course, it is important to understand that it's normal to feel a bit anxious or sad or moody during major pandemic crisis like the one we've been living with. But if you feel like your mental health has been significantly affected, then I'll tell you some of recommendations and resources. So first, I would suggest you to track your symptoms, whether that's through an app or smartwatches like the Apple or Samsung Watch or Fitbit, or even on a piece of paper. My suggestion is that you keep and create a diary and track your routine and your symptoms on a daily basis, because by doing so, that will help you identify the areas and where you can improve your daily routine. There are also some excellent online resources to help us better managing our anxiety, stress levels, and our mood, symptoms that can often disrupt our sleep and our ability to maintain a daily routine. So I would direct you to our website. So please check our Canbind website, where we have listed many of these resources. So it's www.canbind.ca, and look at the COVID-19 Mental Health Coping Resource Center. But then if you find that none of these suggestions work for you, or if you find your symptoms are way too much for you to manage yourself, of course, contact your healthcare professional and ask for an assessment. Rest assured, you are not alone. Well, a lot of people find that, having a tea, a calming tea, low caffeine or preferably no caffeinated tea in the evening helps them calming down. Things like chamomile tea and things like that sometimes can help. Some people find in melatonin over the counter some help for their sleep. If that's the case, I would not suggest high dosage of melatonin. I would suggest you start with 0.5, 1 milligrams up to 2 or 3 milligrams of melatonin and see if that helps. But of course, keeping a regular exercise routine is also something, like I said before, a healthy way of trying to build what is called a sleep drive. So helps us, feeling relaxed and our brain thinking that we are ready and it's time to go to sleep.